Hey, good afternoon, everybody. It is May 27th, 2020. Dr. Bunio and I are back. Welcome back, Dr. Bunio.
Thank you, Chris.
So how have things been?
Things have been going well.
It's been a busy week.
It's been very busy.
Good, good. I had just a couple of questions for you before we get started. What's your favorite meal? What do you like to eat?
My favorite meal? I like a good hamburger, I'm afraid to say. Good cheeseburger.
A good cheeseburger?
Yeah.
Do you put everything on it, or is it just like you like it plain?
I put everything on
I'm a plain person, so I'll go to like Neighbors and get a triple cheeseburger plain.
I love a Neighbor's burger, too.
I didn't realize they were hand patted till the other day.
Really?
I crushed a triple cheeseburger and it was this thick. It was so good. So when you were a child, what did you want to be when you grew up?
I really had no idea.
Really?
Yeah, I'd like to say that since I was very young, I wanted to be a doctor, but I cannot say that was true.
Yeah.
I kind of started to get more interested in science, and I really liked the fact that, with the possible exception of the COVID pandemic, science gives us really solid answers.
That's true. That's
and science will eventually. It's just right now, science takes time.
Yeah.
But eventually, it's going to give us the answers we need. So that's what it kind of appealed to me about the medical field and helping people.
Gotcha. Okay. So when I was growing up, I didn't know what I wanted to be either. I wanted to be a lot of things. I remember being little and wanting to be an Egyptologist. It's like an archaeologist, I guess, that works in Egypt.
Mm-hmm.
I loved mummies. I was infatuated with the pyramids and things like that. And so I always wanted to be that. But then I grew up and got into the film area and video and photography. So that's how I got where I am now. But it's always exciting to kind of introduce ourselves to the community and let folks know kind of where we come from. Where were you born?
I was born in Canada.
Okay.
In Winnipeg, which is about the center of the country there.
So did you play hockey or not?
I played a little hockey, but I don't know if you can tell, but I'm not real big and strong. And so, I played pickup games, we played street hockey, things like that. Yeah, hockey's really big where I grew up.
Good, good. Well, we're coming into a week where a lot of folks are going to be coming into some money. I know per capita is coming up, and that's going to be dispersed to the public next week. There's going to be a lot of interest in folks to travel, and so a lot of what we talk about today, I think, is got to do with travel and some of the precautions we should take there if we're going to do that. And so we'll get started again today with our COVID-19 informational hotline. For folks at home, call 828-497-3743. We're still in full testing mode.
That's correct.
Hospital is still looking to get the test results out there from the community. Everybody send somebody, an individual from each home. We're still trying to get out to get tested. And then we'll post, I guess, the testing dates and times along with this so that folks know when to go get tested and where to be at. So if you've been tested, can you get retested?
Absolutely. We really need to have a sample of the community to be tested. It can be you, like say you've been tested a week ago.
Right.
Anytime you're feeling sick, you should maybe volunteer to be tested.
Gotcha.
But if you're just volunteering as part of our surveillance, you want to protect this community, it's okay for you to come back and be tested, a week later, or maybe send another member of your household.
Right. And we've mentioned this a couple of times before. Again, if you're working on the front line, if you're working with the public, that's even more important for you to come on out and get retested as frequently as you can or as you feel comfortable with, right?
Yeah, that's especially important because you have the ability to infect so many more people.
Right.
Because when you're in contact with other people, particularly within that 6 feet,
right.
Hopefully you're wearing a mask, hopefully they're wearing a mask, but if not, one person who's infected could potentially infect 20, 30, 50 people. And that's going to be really tough for us to contain.
Right. If they made a movie about your life, what actor would play you?
Probably Brad Pitt.
That's who I was thinking. It was kind of somewhere between Keanu Reeves and Brad Pitt.
Well, I said it first. So.
Yeah, good, good one. That's what I was thinking exactly. So how often should I be sanitizing or washing my hands?
So I see, there's some examples on there. I use a hand sanitizer after each one of those.
If you're pumping gas or checking your mail or touching things out in the public area.
Yeah, generally, if I drive somewhere, I've got to pick up something. I've been touching things that I don't know who's touched them before me. I'm going to get, back in my car. I'm going to use my hand sanitizer, and then I'm going to feel, safe and protected. So it's a reasonable precaution anytime around your household, of course, that's your stuff.
You're right.
You
right.
don't need to sanitize after that.
But if you're out in the public, make sure you're sanitizing and more importantly, washing your hands.
Yeah, that's actually
before you
even
eat,
better.
after you eat, things that are happening where you're putting your hands near your mouth.
Yeah, and I did want to point out, so you getting the virus on your hands, you're not going to catch it that way.
Right.
It's when you absentmindedly touch your face or your mouth, that's how you get it. So you could touch a bunch of things that have the virus on it, and as long as you keep your hands away from your face, you're
Right.
okay
Right.
until you can get to that hand washing station or that sanitizer.
Right.
So that's just sort of general advice about how it's spread.
Good, good. Are we overreacting? Are masks they seem like a bit much?
We are not overreacting. All you have to do is turn on the news any night and see what's happening in Brazil, what happened in New York City, where places who got overwhelmed.
Is this the case where we haven't really seen it in our community like that maybe we're not taking it as seriously?
I don't know. I mean, again, you can see everywhere that people are not taking it very seriously
Right.
across the country. And unfortunately, there's this delay that's built in so that when a place is about ready to become a hotspot and, their health system becomes overwhelmed, there's usually about a week or two where everything looks fine. And
Gotcha.
then it's uncontrollable.
Gotcha.
We talked that one time about the exponential growth. When something doubles, it can go from 2 people to 100,000 really
Quickly.
fast.
And it starts with folks acting all willy-nilly and not really paying attention to things.
Yes, willy-nilly is a good way to describe
it. Check.
Yeah.
Did you notice I'm growing out my hair?
It looks really good.
I ordered a guitar. I'm going to start a band.
Okay. Well, maybe next time we can have you play something.
No, not yet. I'll need a couple of years for that. What precautions should I take when I travel?
So we understand that people are going to travel.
Right.
So there's safe ways to travel, and then there's riskier ways to travel. If you're traveling in your own vehicle with your immediate family, that is safer.
Okay.
Where you go makes a big difference. So we want you to encourage people to go places where they are not congregated. They're not within 6 feet of other people.
Right.
Big crowds are a bad thing.
Right.
So when you're traveling, take your hand sanitizer. When you pump gas, sanitize
Right.
your hands. When you're around other people where you can't be more than 6 feet, wear your mask. Preferably you pick something like a beach is okay if there's not that many people on it.
Right. Right.
Camping, hunting, fishing. It's a little bit better to stay in accommodations that are reserved for your family, like a cabin. If you can rent a house versus a hotel where you have to go up and down a corridor. Motels that have doors that open to the outside are a little bit safer. So basically you want to avoid all the things we've been warning you about all this time. Big groups of people.
Right.
Not wearing their masks. And, one of the other things, people wonder, well, why can't we open bars yet?
Right.
Well, there's a lot of people in a confined space. And what tends to happen in bars? They play loud music, so you have to yell.
Yeah.
So you're spitting out, for lack of a better word, you're spitting out more droplets and more virus. If you are an asymptomatic carrier, that's just a perfect combination, a perfect storm of passing this to a lot of other people.
Absolutely. And so it's also very important. We mentioned this earlier. If you're going to be out on travel, hitting these spots up, I know restaurants are opening back up, a lot of them to half capacity at least, and you have your kids with you, make sure you carry your sanitizer, make sure you sanitize their hands, making them wash their hands before you eat, after you eat, anything that they've come in contact with. You make sure the kids have certainly washed their hands and been sanitized, because kids are notorious for grabbing and touching and putting their hands right in their mouths, and it'd be an easy spot for them to pick that up and then pass it on to the family and then ultimately bring it back here to the community. So please make sure your children are washing their hands and taking all the precautions as well.
Yeah, restaurants are going to be tough. And when you go to a restaurant, you want to see that the wait staff are wearing masks. You want to see them wiping down tables and chairs and stuff frequently. You want to see that they're taking it seriously. If they're not, I would turn around and go somewhere
to another
else.
Location.
The best thing, of course, is still takeout. We want to support the restaurants as much as possible, but you don't want to put your family at risk.
Correct. Okay, good deal. So I just went on vacation. Should I be retested when I get back?
Well, sure. Part of that depends on what kind of vacation you took.
Okay.
What was the risk level? Obviously, we're encouraging people to get tested periodically as much as they want to.
Right.
So if you want to get tested when you come back from vacation, by all means, we'd be happy to accommodate you.
So do you like your eggs scrambled or over easy?
Over easy.
Okay.
That was a tough question.
I know. They're getting harder.
Yeah.
How often should I wash my mask?
They recommend washing it after, you use it. So if you've been out for the day, it'd be a good idea to wash it after that.
Gotcha.
Part of that, depends. And anytime it gets soiled, you need to wash it. We talk about this sort of 6 foot distance,
Right.
10 minutes. There's nothing magical about any of those numbers. So if you're walking down an aisle and hopefully you're following the arrows, so you're going all in the same direction. But if somebody's coming towards you and they cough, so particles from a cough can go up to 50 miles an hour.
Right.
You try to get out of the way of
You
that.
can't outrun that.
A sneeze can generate particles that are up to 100 miles an hour.
I black out when I sneeze.
Well, that would
That's
be
how
bad,
hard I sneeze.
because someone might try to resuscitate you. But if you've been around, this should trigger like a red flag for people. If you've been around, so if I see somebody and I'm in the store and I see somebody cough, I kind of back up or go the other way, because I know that there's going to be particles in the air there that I could walk through,
Right.
even if I'm walking behind them. These are just things that we're just going to have to get used to.
Be aware of.
Yeah.
Good deal. So how long can I wear my disposable mask? Now, a lot of folks are wearing the disposable masks.
Yeah. Disposable masks are really not meant to be worn over and over again. Generally, but it's the same thing we've said before. Some type of mask is better than no type
Right.
of mask. So you would either just wear it for one occasion or one day, or another strategy is, if the mask is not soiled, if you want to put it in a paper bag and leave it for 3 or 4 days. Usually, any virus that might have got on there will have died in that period of time.
So if you can get your hands on a week's supply of them,
I would just throw them away.
You could recycle them
Yeah,
or throw them away.
Yeah, you can do that. You can recycle them. If you have a mask for Monday and a mask for
Right.
Tuesday.
A Monday mask.
Yeah,
I like
Monday
that.
mask.
I like
yeah.
that idea.
That'd be good.
So to differentiate, though, the masks that you and I are wearing today, these are cloth.
Mm-hmm.
These can be worn a few times as long as you're not touching them like I just did. And if you do, you need to sanitize your hands first and then make your adjustments. But these are worn a few times, and then we recommend washing them, hand washing or washing them in hot water.
Yeah, one of the differences is you can wash these.
Right. You cannot wash this.
You try to wash a disposable mask, it'll disintegrate.
Okay.
Yep.
So are you a Ford or a Chevy guy?
I'm a Subaru.
Okay. Like the all-wheel drive precision, huh?
Yeah. I like to get to work.
Only because we live in a climate where there's a lot of snow and ice, you need that all-wheel drive.
Yep.
So if drive-through testing isn't available and I want to get retested, where do I go?
Well, we regularly publish, of course, when the drive-through testing is available. If you're feeling sick and you feel like you need to be tested, by all means, you can come to the emergency room. We do recommend you call ahead, call your primary care provider, or even call the ER and say, hey, you're interested in getting tested. The best possible thing is, if you're not feeling that bad and you're not in any distress, that you just wait for the next drive-through testing time.
Okay.
But if it's absolutely necessary, we can make arrangements to have you tested in a safe way.
Gotcha.
Yeah.
Okay. And I think that's all of our questions for the day, except for mine. I have a few more.
Okay.
So,
Oh.
What's your favorite movie?
My favorite movie is Henry V.
That sounds really exciting.
It was. It's actually really fun. Kenneth Branagh. I just love that movie.
Okay. And then are you a Wyatt Earp or a Doc Holliday kind of person?
I think a little bit more of a Wyatt Earp.
Okay.
I think Doc Holliday was a little bit more of a rebel than
He was.
Yeah.
Is
And a
Tombstone not your
gambler.
favorite country western movie? Or
what-
whatever you call that.
What was the question?
Tombstone? Have you seen it?
Tombstone? Yeah, I've seen that
Yeah.
one. Yeah. Yeah, there's a lot of good Western movies. I can't really think of a favorite just off.
Do you have a favorite movie in general?
Well, I like that Henry V.
Okay.
Yeah, that's one of my favorites. I like Shawshank Redemption.
Okay.
I like that one quite a lot.
Good.
Nowadays there's a lot of good stuff to stay home and watch.
That's right.
So,
get your Netflix subscription, get your Amazon Prime, and watch it on there.
Yeah.
Shashi, do we have any questions from the public?
We just have not technically COVID related, but we have a announcement. Our hospital phone lines are down, and our IT staff's working on.
Okay, so the hospital phone lines are down temporarily. IT department is working to get those restored as we speak.
Yes.
Okay, so if you're calling in and you're not getting that through, just give them a few. They're working on that right now diligently.
So, I just wanted to mention one more thing, Chris, before
absolutely.
we wrap up. I think we're in this period right now where things are pretty well under control, but I want to emphasize that this is our opportunity to get a little rest and relaxation, but also prepare.
Right.
All I can say is winter is coming.
Ooh, I like it. So you're a Game of Thrones fan as well.
Yeah, absolutely. I love Game of Thrones. So winter is coming, and there's an enemy at the gates. And if we use this time wisely and we prepare, we will survive. And so I want to encourage everybody, just get into these safe habits.
Good.
This should become second nature.
Good.
Wear your mask, wash your hands, practice social distancing, and then we can get through this.
Scott, if you're at home watching this from the One Feather, make sure you quote that. That was really good. I think it needs the big bullet thing on front page. But no, Dr. Bunio, thank you so much for coming on. I know the public enjoys watching us and seeing the updates on some of the questions that they have about the COVID-19 response and what we're doing. So if you're at home, please continue to take these safety precautions. Wash your hands, wash your children's hands. If you're going to go out of town, which, it'd be best if you could stay at home, but if you have to get out of town, we understand everybody's got a little cabin fever and everybody wants to treat themselves a little bit. Please practice safe habits during this time. Make sure that when you get back, if you want to get tested a few days later, get tested at the hospital. We'll post those dates and times, and make sure you keep your community safe. Do your part, please. We'll talk to you again very soon. Dede Dagahunyu.